If you want to get results for your health, CVS is offering free heart screening clinics every Thursday in February at select locations across the country and right here in our area.
And heart disease can also be prevented when people make healthy choices. Communities, health professionals, and families all play a vital part in that.
And speaking of that, Nikki Magyar from Right at Home in Orlando joins us now with more about how quality home care can benefit seniors in Central Florida. Thanks for being here. And
thank you for having me.
Tell us about what Right at Home is and how to determine if this is something that's right for you or a loved one versus a facility.
Absolutely. So Right at Home is really for anyone, an aging adult, a disabled adult, someone with a chronic illness like heart disease. But what we do is anything from transportation, companion care, personal care, all the way to end-of-life care. So it really is just tailored specifically to that person's needs. It really does help that person stay out of the hospital and to reduce readmissions like what you were talking about earlier.
So what are some of those benefits, you touched on it a little bit, but in home care versus being in a facility, why do people love to have you come to them versus them going to a doctor or a clinic?
Absolutely. So our CNAs are trained and managed. We're available 24/7. We go straight to their home. We provide personal care plans tailored specifically to what their needs are and one-on-one care at home or wherever they consider home at this point. So even if they're at a facility, we can still go to them, but we're there for them with a lower ratio of people there. We're able to tailor the needs for, say, like their diet. Maybe they have a specific diet. So it gives them the opportunity to go to the grocery store with us, or we can go for them. We can pick out different items that maybe lets them have low sodium, low sugar, all those healthy options, and not have to get those prepackaged meals so that they can really live longer and have a more healthy lifestyle.
I mean, it's a very detailed, very focus-oriented kind of mission that you guys have. I mean, what other type of different kind of options that you can also offer? So, I mean, there's things like grocery shopping with them. What are other options?
Sure. So honestly, we do anything from bringing someone to Disney World all the way to, as I was saying, like end-of-life care. So we do feeding, ambulation, bathing, toileting, but it really gives that person a sense of dignity. They have that one-on-one. They've really become committed to that caregiver. They've bonded. They've learned a lot about each other. There's a sandwich generation that we have now, right? So you're trying to take care of your elderly loved one, but you're still working, or you're taking care of your grandkids. So Right at Home provides a service that allows you to lean on another caregiver, a professional caregiver, that might even be able to teach you a few things to help your loved one stay safe at home. So our mission is really to improve the life of those we serve, and that's all we're here for.
And you talked about going grocery shopping and help select appropriate meals. What other things are you guys helping to improve heart health, and what can we be doing at home?
Absolutely. So with heart health specifically, if they may have already went to the hospital due to a heart attack or some sort of feeling of that need, so they've had stress on their heart. Light exercise is something we can do with people on a regular basis, whether that means they're going to go swimming, they're on their bike, or we're just walking. Whatever their physician has really recommended for them, we can follow that protocol, as well as their physical therapists. On top of that, we can recommend things like a low sodium diet and a low sugar diet. But another thing too is that most people who have diabetes, about 60% of them actually also end up with a heart disease. And so we focus on those types of people as well. Make sure that we tailor all of our specific day-to-day activities. And some days might be better than others with someone. Maybe they have a cognitive impairment. Maybe they, a lot of seniors, they have a number of different things going on, whether they're maybe having just a tired day or they want to go out and see their friends and they just can't do it on their own. So Right at Home's available to help them stay more independent, help them get to do what they still want to do, go see their loved ones, stay involved, don't get into their shell. They really want to be there for them.
So is it quickly, if you are interested, is there, a lot of availability, and is that something that's covered through, Medicaid and different types of insurance, or is it all out of pocket?
So long-term care insurance covers Right at Home care. So our CNAs and home health aides, Medicare is outside of the scope of what we do because that is actually skilled care. And so our CNAs and home health aides, they're taken care of through maybe veterans assistance. We do work with the VA directly. We also, as I said, long-term care insurance. There are a couple different options through maybe flexible spending accounts and things like that that people can pay for the services directly.
Great. Nikki, thank you so much.
Thank you for having me.
Hopefully people will consider that as they look at ways to care for their loved ones, make sure they're eating right, moving enough to keep them around longer. Thank you.
Absolutely. Thank you.